Hello, I'm Armin Budish. Welcome to Golden Opportunities.
Today, we resolve to help with your New Year's health resolutions. Then, when should you involve your family in your finances? We'll relate the right response. The Westside Market is still cooking at 100 years old. We'll share the recipe for its success. Plus, looking for ways to get a jump on the job market? Our interview helps get you hired. And how to avoid the Medicare enrollment trap.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Over the holidays, overindulging is as easy as pie and cookies and cake, but those waist-widening temptations can also herald harmful heartburn. Dr. Ronnie Foss is here today with easy-to-swallow advice for overcoming unremitting indigestion. Dr. Foss is the new director of gastroenterology at Metro Health. Thanks for joining us, Doctor.
Thank you very much, Armin, for having me.
So we all get heartburn once in a while from overeating, overindulging, but some of us get heartburn all year round, all the time. What's going on there?
So we have to remember that many of us, actually about 40% of the adult population in the U.S. have what we call gastroesophageal reflux disease. And that could be the manifestation of that disorder. And what is it is that there is a malfunction of the sphincter, the valve between the esophagus and the stomach, and it just doesn't work very well for many of us. And as a result, stomach content may wash back into the esophagus, leading to heartburn.
And is that called GERD? Is that what we've heard as GERD?
Yeah, it's GERD is the abbreviation of gastroesophageal reflux disease.
And so what, heartburn, we all know, does it cause other symptoms too?
Oh yes, it causes a variety of symptoms, all the way from heartburn, as you mentioned, but it can also can lead to a lot of burping. It can lead also to stomach acid coming back all the way to the mouth. It can cause also sour taste in the mouth. So there are various symptoms.
Okay, and I'm looking at causes. Does our weight have anything to do with getting GERD?
Oh yes, unfortunately, we see it more in the last few years as our weight increases in the general population. And there is a close correlation between weight and symptoms of gastroesophageal reflux disease.
Right, so, we have heartburn, we have the acid reflux, whatever. Can this cause long-lasting problems?
Yes. Actually, gastroesophageal reflux disease can cause a variety of complications.
Like what?
For example, like inflammation in the esophagus, what we call erosive esophagitis. It can cause narrowing of the esophagus, what we call stricture. It can cause ulceration in the esophagus. It can even cause precancerous changes in the esophagus, called Barrett's esophagus, and even cancer of the esophagus, which is, by the way, the fastest rising cancer in this country today.
So you mentioned weight as a reason why we get this or enhances it. Does that mean that if we lose weight, we can get rid of the heartburn and the reflux and the GERD?
That's true. If you lose weight, and there is sufficient evidence to support that, you can reduce your symptoms, you can improve all the potential complications and even the inflammation in your esophagus.
Is there medication or some other treatment if just losing weight isn't the answer for us?
Of course. If you have long-term history of heartburn, you should probably see a physician and tell them about these symptoms, because there are a variety of medications that they can offer you to treat this problem, and usually they are pretty effective.
Are there downsides? Are there, I don't know what you call it, bad things that can happen if you take medications for GERD?
As long as you stick to what your physician tells you, then these medications are relatively safe. Obviously, like any other medications, there are potential of side effects in the short term and then potentially side effects in the long term. But overall, they're pretty safe medications.
Are there things, by the way, that we should avoid eating if we have this problem? I mean, spicy foods obviously are long gone out of my diet. Are those things that we have to watch out for?
Yes. Usually what I recommend to patients is to stick to whatever they feel exacerbate or causes their symptoms and avoid that rather than give them a long laundry list of what to avoid. But if you ask me in general, yes, spicy food, large meals, fatty meal, chocolate, peppermint.
Don't say it.
Yeah, orange juice, tomato juice, all have been shown to cause symptoms.
Thank you very much, Doctor. Very good information. So heartburn can be hazardous to your health. If persistent indigestion has become your pattern, it could be GERD. Get yourself to the gastroenterology group at Metro Health. Call 778-5736 for more information. My thanks to Dr. Foss for feeding us such important information today.
For more information, call Metro Health at 216-778-7800 or visit www.metrohealth.org. Next, when to share your wealth of info on your finances.